Okay, so another question that you may have is what are there ways to avoid having your child get the CF gene? And yes, there are. With advanced technology, we have 2 procedures in line that can help with testing your child before you conceive to see if they have the CF gene or any other genetic disorders that may come along. And both of those include in vitro fertilization and PGD, which stands for pre-implantation genetic diagnosis. And both of those involve either a zygote or an embryo. And it's a procedure just to see if your child will get genetic disorders.
Mm-hmm. The PGD itself is the test that we perform over the genes, and then in vitro fertilization is how we would take your petri dish baby and insert it.
And also there's always that hope of doing that before you genetically getting tested, mm-hmm. that your child will not have a possibility of even being affected by the CF gene, since it is a recessive trait. Another question is what treatment plans are most affordable and effective, and we have come up with a conclusion that there's really not one treatment that is most effective. It's more of a combination or a concoction of 2 or 3 or all of them if possible. And some of those are ACTs or airway clearance therapies, which are very affordable, like we said. They can be done by the guardian or by another adult if they're under 2. And also we have airway clearance therapies, we have medications, we have antibiotics, we have
bronchodilators and nebulizers.
Yeah. And along with those all help with taking the lungs and thinning taking the mucus and thinning that out and being able to cough it up.
Mm-hmm. With that, you need some antibacterials also, and antibiotics.
Helping you breathe. Antibiotics help with infections, and also nebulizers come more into play when the child becomes older because they're more active, they're more independent. The combination field is very wide, and there's really no treatment that is the best one, but it's more of the combination that works affordably and effectively. And also there's other options if we want to get in touch with a specialized CF doctor, not us, just here at Genetic Counselors. We do have some recommendations.
Yes.
So what we have come up with that there's either the option of doing your pre-implantation and the in vitro, or that's before conceiving, and then if you want to wait until you do conceive, then we can do newborn screening. Mm-hmm. And also with that, the most highly recommended thing that we can tell you is that you should get genetically tested first.
Yeah.
Because that goes along with
the pedigree that we showed you earlier.
And then Gina with your brother and your nephew having that being affected by the CF gene, and also the possibility of, since your brother is a carrier, and if you could be a carrier. So that's what we want to know. That's what we want to tell you that's most important.
And that would be the most preventative method, because PGD is not always a complete success with in vitro fertilization.
Yes.
Or newborn screening.
And
Your child would already have the disease, and we would have to deal with it for the rest of their lives.
And also the possibility of moral and social issues come about with that, with both the before conceiving in vitro and PGD options.
Obviously, your religious and moral belief, your background will make you make that decision, and it's completely up to you. We understand that it's a very difficult decision, definitely, because having a child is not an easy choice, and it's going to change your life for the rest of it.
And having a child with a disease is not an easy thing to handle, and there's emotions that can come along with that, like fear, anxiety, depression, and stress. And those can be helped with coming to genetic counselors like us, and also doing parent support groups. Mm-hmm. And just if you're not able to love that child, then we can either do adoption, or we can do other things.
Yeah.
All the options.
So we hope that you take your options and you weigh them. Come back to us if you have any more questions. We're here to help you guys out.
We're here to answer them.
We are counselors.
We're here for support.
Yeah. So please come back with your decision whenever you're ready.
Yeah.
Thank you.